In this part, we look deeper into the relationship between water, salt, and life itself inside the human body. About 70% of the human body consists of water. Sodium chloride, common table salt, which we consume daily in different forms in our food, dissolves immediately in the water present inside the body as soon as it enters. If a person consumes too little salt, several complications may arise and the body may become ill. If a person consumes too much salt, most people know that it can increase blood pressure. However, very few people actually understand why and how excessive salt raises blood pressure. The 70% water present in the human body becomes almost useless without salt, because salt activates this water for life processes and helps maintain the balance of internal body fluids. Water enters the body through food-breathing skin absorption. After entering the body, it reaches the bloodstream, and through blood circulation, it affects every system and organ of the body. It especially affects the nervous system, keeps the skin tissues, brain, nerves, and mucous membranes moist, and maintains proper hydration. Water also performs several vital functions. It helps make food digestible. It transports digested nutrients to every cell. It helps remove toxins and waste materials from the body and transports them to the excretory organs. Importance of salt in the body. The water that makes up such a large portion of the human body is responsible for birth life, maintenance of life, body functions, survival. But without salt, this water becomes little more than an unnecessary burden. This means salt is more important than many other minerals in the blood. Salt does not dissolve in alcohol, but many medicines can dissolve in saline solutions even when they cannot dissolve in plain water. Salt naturally contains reproductive and generative properties, which help the body produce vital substances and compounds necessary for maintaining health. During the body's metabolic processes, many waste substances are produced. Salt plays an important role in removing these waste products from the body. However, it is essential to ensure that the amount of salt in the diet does not fall below the body's requirement. Effects of too little or too much salt. Just as salt deficiency can produce abnormal symptoms in the body and may even lead to death, excessive salt consumption can also cause diseases and may even become life-threatening. Despite this, salt remains essential for life, just like sugar or sweetness, which is also necessary for the body. If sweetness is completely eliminated, the body often begins to feel weak and fatigued. How much salt should be consumed? Many people may wonder, how can we know how much salt the body needs? To understand whether salt is too little or too much, it is important to understand the foods that increase salt levels in the body. Use of saline in allopathic medicine. In allopathic clinical practice, normal saline, salt solution, is widely used. People commonly refer to it as getting a saline drip. It is true that many patients who are close to death are saved through this saline drip. In my opinion, some allopathic medicines are extremely useful in critical situations, and intravenous saline is one of them because it can provide immediate relief. Note on appreciating other medical systems. Some people may wonder why I am praising allopathic medicines. The answer is simple. Whenever someone does something beneficial, acknowledging it is a sign of greatness. In the field of medicine, the priority should always be humanity and patient care. Religion, language, or nationality should not matter. Every human being is a creation of God, and our responsibility is to serve humanity. Comments on homeopathy and biochemic therapy. Homeopathy is a very complex system. I have studied it carefully. There are hundreds of thousands of remedies, and treatment depends entirely on matching the exact symptoms of the patient with the correct remedy. If the symptoms match, the medicine works. Otherwise, it has no effect. For a single disease, a practitioner may need to consider thousands of remedies. In contrast, The biochemic system of medicine treats diseases using about 12 mineral salts. However, it also has a limitation. It does not strictly follow the organ-based method of treatment. If these salts are used according to the organ-based principles, the method becomes much more effective. In biochemic medicine, common salt is also used and is known as natrum muriaticum. Salt is also included in the pharmacopoeia of the theory of single organs, Nazria-e Mufrad Azza, and has been used in classical traditional medicine as well. In fact, many digestive powders and remedies contain large amounts of salt. Some digestive formulations even contain double the amount of salt along with other ingredients. However, such high quantities are not always correct and should only be used in certain cases, such as strong laxative formulations. If you want, I can also compile all philosophy of medicine parts, 1 to 9, into a clean English book-style document, which will look much more professional for articles, PDFs, or YouTube scripts.